Good morning, councillors, officers and viewing public. Welcome to this meeting of the Health and Social Care Review and Scrutiny Committee. Remind members that the meeting will be webcast for live subsequent broadcast by the council YouTube site, and that members of the press public may record, take photographs, except where they are confidential or exempt items. Can I remind officers and guests joining on Teams to please keep their camera and microphones off unless speaking, and to please use the raise hand button if they want to speak. For officers and guests in the room, please speak directly into the microphones to ensure that the live stream is clearly audible. Apologies. Can I ask members and scrutiny officers if we've received any apologies to the best of my knowledge? Declarations of interest? Can I ask if there are any? Thank you for that. Action notes and matters rising.
We need to approve the action note that we held from the 21st of February, which is in the action plan.
So are we able to agree the minutes on the 21st, or are there any matters arising from that meeting? So happy to agree that. Thank you for that. In terms of the action plan, rather than a large collection of issues which I actually report back onto each session, it's been agreed that we can include an action tracker, which will be included in the agenda papers going forward, which is effectively in line with what other scrutiny committees are actually doing. So the first item on the agenda is the report of the Cabinet Member for Health and Social Care, Councillor Marion Carr, who will be supported by Professor Graham. We've got 40 minutes for this item, and I thought if we did 50 minutes of presentation and then 25 minutes for questions and comments. So over to yourselves, Councillor Carr and Professor Betts.
Thank you, Chair. I can just check to see presentation is being shared before I go into it. Good morning, everyone, and thank you for inviting me back to HOSC to give an update on the progress against the priorities that I set out in September last year. I know that members would have received the written report that I submitted prior to the meeting, and it does give a lot of detail in terms of the sort of key updates within key areas of both adult social care and also public health. So I'm not really going to go into all of them now, but I think it might make sense for me to pause for a moment. So I think it might make sense for me to remind members of HOSC what the key priorities were, and just give you a few tangible examples of what's happened within the areas and some of the key stakeholders that I've engaged with in the past 6 months. So they were the sort of key headlines there. So one of the first areas that I brought to as a priority was around health inequalities. And since I launched the Black Year Report as one of my very first official engagements as a Cabinet Member back in June 2022, we've made great progress and have set up the Black Year Implementation Board. As we're seeking an independent chair for the board, I've been chairing the session in an interim capacity until we appoint, and the work has been a key component of our work on tackling health inequalities. The Black Year Implementation Board has been operational since October 2022, and it's now focused on the implementation with a robust forward plan of activity until the end of March 2024. And some of the things within that include working with community engagement partners who are co-producing solutions to improving cultural competency, anti-racist practice, and the collection of ethnicity data, as well as working with the ICS to take forward an improvement programme. And then also delivering specific projects like targeted weight management programs tailored for African and Caribbean communities, developing community health profiles, piloting of free text-based ethnic self-identification in population surveys, and delivering targeted mental health and suicide prevention interventions, and developing culturally relevant healthy eating guidance. Community engagement partners who have been commissioned to facilitate community involvement in the implementation project are actively promoting the findings from the review and supporting co-production activity. And I'm also delighted to inform members of HOSC that our work with Lewisham has been shortlisted for a Local Government Chronicle Award for Diversity. I think also on that slide in the middle photograph is from earlier, it might not have been early this month, it's potentially, it was early this month. So it was early this month, alongside colleagues from the Active Wellbeing Society, I welcome guests from Sport England for them to see some of the outcomes of our local delivery pilot Active Communities in action. And the Active Communities programme focuses on testing and learning that works to help create stronger, more resilient communities, and it's embedded in the communities that it serves, where basically it goes to meeting people where they are, working with them to identify and tackle barriers being physically active. The visit was an opportunity to see how we take a whole systems approach to removing the barriers to participation, tackling inequalities, and co-create free activities and interventions that harness active citizenship and support people to be more physically, civically, and socially active. And then we also took Sport England out to my ward in Allen Rock to visit the Naseby Youth Centre to see how local youth providers and wider system partners are demonstrating how an emerging co-designed charter is bringing the system together in Birmingham to deliver better outcomes for young people. And then the visit, the people on the visit from Sport England also got to see Omnia GP practice and the Yardley Green Medical Centre to learn about the holistic intervention, and also see the new Cycle Hub, where they heard from practice staff and partners involved in the co-design of innovative place-based services to tackle health inequalities. And then they also went on to the Ladywood Share Shack, which is one of our warm welcome spaces. And they saw how sharing items, skills and building connections supports people into physical activity. We were also able to share other place-based interventions and share about the learning from the local delivery pilot so far, and how we are able to demonstrate impact and evidence before they joined a meal prepared by the Big Feed team using food that otherwise would have gone to waste. And then the third picture on that slide is from when I hosted a delegation from the United Nations who came to Birmingham as a follow-up visit of the working group on the experiences of people of African descent back in January. And as well as sharing our experiences on the Black Year Review with them, they heard from colleagues in children's and also from the Equalities Insight and Strategy Director on our work on the demography of Birmingham and the newly launched City Observatory, and our work on rights respect in schools with UNICEF before they had a briefing from the Police and Crime Commissioner's Office on law enforcement experience and engagement. That gives you a bit of a sort of rundown in terms of the tackling health inequalities priority and some of the work that has gone on for the last sort of 6 months since I last attended HOSC in that area. There's obviously lots more that can be done, but this is just to give a bit of an insight, and there's further detail in the report that you've already received. And the next slide is on the post-pandemic situation. The Active Wellbeing Society, or as members already know, played a pivotal role during the pandemic in many ways, from collecting and distributing food parcels to running virtual activities to keep people active and befriending sessions to help lonely and vulnerable people. And much of that work is still ongoing, and networks and connections that were made during the pandemic have played a key role in post-pandemic and certainly during the cost of living crisis. One of the key components and areas that has been as a result of having the post-pandemic situation is social prescribing, which is a key component of universal personalised care. It's an approach that connects people to activities and groups and services in their community to meet the practical, social and emotional needs that affect their health and well-being. And I was able to join NHS England colleagues from the National Social Prescribing Team on a day of visits in Birmingham in January and meet people who are benefiting firsthand from the services. Projects like the Community Garden at Victoria Road GP Surgery in Acox Green, where people can come together in the garden and just chat and enjoy the outdoors at their GP surgery, or enjoy all the initiatives on offer at the Iridium Medical Practice, where I've been a couple of times now. And that's just a few of the photographs from some of those visits. And then another issue that I've made a commitment is around sepsis. Following a question from a member of public at the council in July, I've met with the founder and fundraising officer from the Sepsis Trust, and we're taking steps to become the first sepsis savvy council, which will see us delivering webinars with the assistance of the Sepsis Trust and disseminating information to staff and members of the council to help raise awareness of the causes and symptoms of sepsis. which is a life-threatening condition and can arise from any infection. And in the UK alone, sepsis claims the lives of around 48,000 people every year, and that's more than bowel, breast, and prostate cancer combined. The next slide should sort of lead into the cost of living crisis. Since we met in September, and obviously discussed how the cost of living crisis was already a problem for citizens across Birmingham, but we were very aware that as we approach the winter months, it was going to affect people much more harshly. And we've obviously sort of we're in March now, we've experienced the different ways that the council has supported people during the cost of living emergency through practical ways. And one of these ways was through the establishment of a network of approximately, so far, around 200 warm welcome spaces where people can access anything from food, shelter and company to advice and practical items such as clothing and other items like slow cookers. And I know that you're an advocate of those, Councillor Tilsley, and I've ensured that I continue to put it firmly on the agenda wherever I've had the opportunity to raise it, for things such as the Health and Wellbeing Board and any of the sub-forums as part of the Health and Wellbeing Board, one of which is they're creating a Healthy Food City Forum, which is taking place right now, and I should be chairing it, and I will be continuing to chair it as soon as I leave from POSC. There was a bit of a diary clash this morning. Aside from that, I've spoken at various different events with partners about the cost of living and about what the council is doing to support people in Birmingham, including a cross-partner event that was organised by BBSC and at the National Pensioners Convention. There's some photographs from there. On the left of the slide, there's representatives from Age UK, the Older Persons Commissioner for Wales, and Lord Foulkes, who's the chair of the APPG on Ageing and Older People. And in response to the cost of living crisis, again, I've worked with the food systems team within public health and integrated their response into the work being done corporately to address the challenges. It also, I mean, it's already stated in the written report what the food systems team response to the cost of living crisis has included, and it's things such as setting up and administrating the emergency food aid fund, which is a grant scheme for 100 food banks and other food projects in the city, and some of the other things such as setting up the Affordable Food Infrastructure Fund, which provide equipment such as fridges and cookers to 75 food banks and food pantries. That fund is still currently open until the 17th of March. If people are aware of any organisations that could still benefit from that. And also, I've been out to visit other initiatives such as Incredible Surplus, pictured in the middle there, who do amazing things by intercepting food and other usable materials that would have otherwise gone to waste from supermarkets, restaurants and other sources, and provide them to individuals and community organisations that can purchase them on a pay-as-you-feel basis. And the next slide covers mental health as one of the other priorities that I outlined in September. And I set my commitment at that point as one of the key priorities, and I'm delighted that the public mental health team has successfully become a signatory of the Prevention Concordat for Better Mental Health consensus statement, which is a system-wide commitment to working towards the improvement of mental health. The Prevention Concordat for Better Mental Health is underpinned by an understanding that taking a prevention-focused approach to improving the public's mental health has now been shown to make a valuable contribution to achieving a fairer and more equitable society. And the next step for the P14 of public health is to determine how the Prevention Concordat principles and commitment will now be effectively incorporated into any of the ongoing and upcoming projects that we've got and the different work streams. World Mental Health Day is on the 10th of October, and last year's theme was to make mental health and well-being for all a global priority. And I know that there's further information in the update that's provided on that within the report. And then possibly the last slide, was around partnership working, including the ICS. On the 7th of Feb, I chaired our Birmingham and Solihull Integrated Care Partnership meeting, which focused on the very important issue of prevention in public health and violence reduction. And as set out in our integrated care strategy, prevention is key to improving population health and curbing the ever-increasing demand for healthcare services. And it was clear from the meeting that as prevention is key to addressing so many of our challenges, both within the health and care system and as a route for addressing wider issues in society, it was agreed that prevention was going to be a continued theme for the next meeting, which is due to take place in May. And next month, I will be attending a general practice staff and allies equalities, diversity and inclusion network meeting of clinical and non-clinical staff who meet once a month to discuss topics that are relevant in the EDI space. And initially that was supposed to have taken place this month, but they've had to postpone it because of other issues, such as, again, winter pressures across the system. So it was a theme around celebrating International Women's Day. And so that the reason they invited me was to share my experience as a woman that's come from a diverse background, but working in the health sector world. And I'm really just looking forward to hearing about the shared experience from other females that will be at that meeting when it does take place, hopefully next month. And then finally, last sort of two pictures there. I've just returned from Brussels last week, where I was representing the city at a Eurocities high-level event with city leaders and members of the European Commission discussing urban food policies from citizen inclusion, system policy and strategy for production, and ensuring seldom heard voices that are heard. And the purpose of the meeting was to influence EU legislative proposals relating to food and for them to learn about our food strategy that we've got in Birmingham. So I'm going to end there and hand back to you, Chair, and see if there's any questions from members. And I thought I'd give a bit of a sort of few examples on the priorities that I outlined in September, but as I've already said, that there is a more detailed report that was sent across prior to the meeting. Thank you.
Okay, thank you, Councillor Clark. That was a really useful and valuable presentation, so thank you very much. Ben, so any question? Councillor Moore.
Thank you, Chair. First of all, I'm a trustee of Birmingham City Spice Bureau, which has a contract with the ICS. I forgot they were in the cabinet members report. I thought I forgot because they weren't presented. They actually need to declare that. So I'm grateful for the cabinet members' update, but I do have various questions because there are some gaps within her report. And moving to items 6, using resources effectively, you're talking about the recruitment drive there. It doesn't actually state what the number of vacancies are, so I was hoping, could you give an indication of how many vacancies we're currently carrying? And could you clarify what it is? Because it says there at the 17th of February, 167 people were recruited. 160 of those two are the offer stage. What exactly is the offer stage? So that sounds like we've offered the job. That doesn't necessarily mean they've accepted it. So I'm not entirely sure that means they are recruited, because presumably they have to accept the offer. But perhaps I've just misunderstood that. So if she could clarify that point, it's on page 24 of 76. Moving on to page 20. And the next question was in relation to, I understand that there's various community profiles, some of them which are available. When are they going to be shared widely with the council so we're aware of what has been identified? Because I'm certainly keen to understand some of those communities as to what their health needs are. Certainly when we think about water plans, for example, we've got one in Erdington and we're looking to update it obviously every 6 months, and there's things that we've included in that. But if that information has been held centrally and not shared widely, then it's pretty redundant. So is there any plans to share that more widely with the council? I appreciate you've gone to Brussels to influence EU food policy, but we're not a member of the EU anymore. Is there a particular reason why we're doing that? Presumably that won't apply to the UK. It's not definitely better focus on trying to influence UK food policy. So clarify that. There's no reference within the report to fast track cities. I always provide an update as to where we are with that. And we do have a new aid and mooring in the city. I believe it's the only one in the country, so which I believe you also attended at. You certainly sent an email around about it, so I'm just curious to know why there's no update on that. My final question is the Poverty and Truth Commission, which is referred to in the report. It's entirely possible it has passed me by, but I'm not aware of them. I can't see anything in my inbox from them. There is a section on the council website which talks about they're there to strengthen links between the council and partners, which seems ironic because I've not heard of them. I can't find any evidence of them contacting me. And your report suggests there's all this work, but even their website doesn't state who they are. Who are these commissioners? Where are these reports that supposedly done? As a referenced in your update, so because it sounds interesting, but it's all very vague and a bit cloak and dagger from what I can see. So I'm just curious as to who are they and what are these findings that they've supposedly found, presumably on behalf of the city council.
Thank you, Councillor Moore, for your questions. I tried to make a note of all of them, so hopefully I won't miss any out, but you can let me know if I have. So the first one is around using resources effectively, and the specific question was around how many current vacancies we have and how many out of the number that are specified in the report have already been recruited.
It was clarifying what does at the offer stage means.
For the office stage. Can I bring yourself in way to just respond to?
I don't have one with the number of vacancies at this point. I think we can share that, and as you'll imagine, it's constantly moving up and down. Good news is that we have recruited a significant number now, and it's a very large number we've recruited successfully. So that's the good news, and we're not losing as many. That's the other key thing. There's no point bringing a lot of people in and then disappearing after a short time. That's the good news. The figures in the report give you a good idea that 167 have been recruited, as you said, 160. We are currently at an offer stage. That is literally that we have, it's in any job process, you go through the various stages. That means people have been interviewed, they've then been successful, and they've been offered the role, and that's where we're at. So hopefully they will come through quickly.
But on that, presumably they can decline. So you offer the job, they decline. Yeah, but then they're not recruited. That's my point. 162 at the offer stage. That doesn't,
It doesn't mean they'll translate 160.
Yeah.
Quite right.
But the phrase is 160 of those recruited are currently at the offer stage, but they can't be recruited if we've only just made the offer because we don't know if they've accepted them. Yeah. So we've offered 162 jobs. It doesn't.
Yeah, the recruitment programme has delivered 162 potential candidates who are at the offer stage.
Thank you. And the next question was around the community profiles, and I agree with you. I think that they are already, and they will be a very useful tool, but being able to access them is obviously going to be the first step in being able to use them. And I can confirm, but I'm just going to check with Joe. They are all on the website since they've been published.
Yes, those ones that are complete are published, and there are webinars as well, which kind of explain their content.
Yeah. So so you should be able to find them, but if it's easier, I can circulate a link to Ask Members afterwards, so that you can have a look at the different community health profiles. But as Joe has said, the webinars give an opportunity for you to watch back and listen to any of the sort of questions that have been answered as a result of them being published and launched. And then the question on why was I at, well, not why was I at, why was I in Brussels, but why are we taking part in something when we're not part of the EU anymore? So we're still part of Eurocities and have been one of the key founding members when that was set up, and we're still involved at that level. And then the event was also organised with not just Eurocities, but the Milan Urban Food Policy Pact, and we sit on the secretariat for that. So there were a few reasons why we're still involved at that level. And also because we've done a fantastic job with the food strategy in Birmingham. And honestly, whilst I was there, I realised that so many of the cities that were there were just so keen to hear and learn from the good practice that we've had in Birmingham. Obviously, we can still learn from them in different other areas where we may have gaps, but they certainly value some of the stuff that we've done here in Birmingham, specifically around citizen engagement and having that sort of co-produced work. That was kind of the one thing that they wanted us to highlight, so that they can sort of build that into their framework as well. Hopefully that answers that question. And then I hear you, I agree. I've just realised that the Fast Track Cities update isn't in the report, but there's probably about, I don't know how many other areas that have happened, and there's work that's happened in the last sort of 6 months that as I'm sort of flicking through and just checking things that are not in the report, but that doesn't mean that the work hasn't sort of happened, because I've realised that Fast Track Cities, if I'm right, it happened in October, so it was after I attended last HOSC, but I kind of must have just missed the date. But for those, just to give some sort of an update, we are still progressing our involvement as being a fast track city, and I can circulate any sort of more recent information to you and other members if you're interested as well. Because as you said, yes, I was at the memorial launch that took place in, I want to say January, but I don't know if I'm December, was it? Okay. But yeah, so I can send any sort of an update on that. But aside from that, I mean, I know that we had testing week and we did some awareness raising around that. But I'm just remembering that also clashed with Fizz Free February. So that's another, that's something else that we've been involved in throughout that month. So there's lots of different campaigns and things that unfortunately potentially could have been missed off this report, but it's just because there's just so much going on. So apologies that there isn't a written update on Fast Track Cities, but I can circulate something afterwards. And then finally, if I can bring Jo in to talk a little bit more about the Policy Truth Commission.
Yes, so I think that your question responded specifically about who the commissioners were and what their priorities were. So there were 10 community commissioners and 8 civic commissioners. I guess the ones that are most of interest to us are those people, the community commissioners, those with lived experience. So my understanding is that the initial conversations with those individuals then identified what were the priorities for them, which are listed in the paper, those relating to housing, poverty and health. And it's from food, and it's from that basis that they have then influenced strategies which are taking place elsewhere in BCC, including the food strategy that we've just kind of referred to. So I'm happy to provide more detail about their observations and contributions into all of those different kind of pieces of work, if that's what would be helpful.
If I may share, but who are these commissioners? That's my point. So I have no issue with them influencing, city policy and strategy, etc. But I don't know who they are, and there's no information on their website. So who are these mysterious 8 civic commissioners and these 10 community commissioners?
Well, I'm happy to provide that information.
Who they are, just they don't even have it on their website.
Right. Okay.
So I can see it on there. So
yeah,
it just seems strange that this organisation that's supposed to be building with building relationships, but I've not heard of them. I can't find anything out about them.
I'll make sure that you get that list of individuals.
Yeah, that should be publicly available as well, particularly on the community policy.
We'll take that back in terms of, they should be publicly available, and I agree. So if it's the case that it's not easily sort of accessible, then we can take that back, but also make sure that you've got the information we can send out to all HOST members. Sorry if you're going to be bombarded, I'll try and keep it all in one sort of email. But I think that might have been all of your questions, Councillor.
Just on that, Chairman, I think that's important from a transparency perspective. It means we need to know who these people are, particularly if they're influencing policy and strategy, particularly when there's lots of criticism of people being too close to one another.
Yeah, that's fine. Thank you.
Thank you, Chair, and thank you to the Cabinet Member for the report. So just a few from me. On pages 5 and 6, under 4.2, there's talk about commissioning services and particularly those with learning disabilities and the Alston framework. So my question there is, how, in terms of commissioning, is it going to ensure, because obviously we know in social care there's an issue with the rates that are paid and the cost, how is the council going to ensure that the organisation recruited are going to be paying the council, paying a living wage, and are the rates the council pay for that service is going to be ensure that is possible. Second question, I also picked up on the offers and recruitment thing, so I can just to follow up on Councillor Moore's point on that one. In future, can we be accurate about what it is and what stage we're at? Because it did feel a little bit in that report that the council was patting itself on the back for work that's not quite yet finished. Because if all those 126 people don't accept the offer, then we haven't recruited that number of people. So I think just that clarity, and maybe if the recruitment process isn't finished till the next time's report, maybe save that success till it's actually signed and sealed, would be my advice. On page 9 under 7.2, to the ICB, ICS, what extent are non-NHS providers going to be included and influence that kind of decision making in as part of the new system? And also on 7.4, the mention of subsidiarity, which is a point we've made before here. And who is that subsidiarity for? Is it for the component parts of the health and social care system? Or do we mean actual subsidiarity in terms of communities having a real say and input into their local services? So again, what do we mean? So I take that as subsidiarity meaning communities having a real input. But if we just mean the component parts, the service provider or whatever, then that's only part of the picture. And my final question would be around under 8.1. And it's really good to see that the cabinet member outlining the use of the youth centres and their role in the kitchens, providing, they'll just say the report, nutritious, not young people. I'm sure it wasn't the people who were nutritious, but I'll set that typo aside. But yeah, so it's fantastic to see kind of how those youth centres are being used to provide those meals. And considering this again shows how important versatile youth centres can be, and how important they are to wider, broader health and public health determinants. What's being done to kind of make sure that those cuts to the youth service funding that's going to come in 2024, that was approved in the budget last month, don't happen. Because obviously, if funding is cut for youth centres, that sort of project won't be able to be done in the future. So yeah, that's the final question on that one. Thank you, Chair.
Thank you. Thanks, Richard, for your questions. Apologies, the first question that you asked around the commissioning and rates of pay, I wasn't able to follow where on the report you wanted.
So under 4.2, it talks about directorates working with system partners and people with lived experience to develop life courses of commissioning services to children, young people and adults with learning disability and or autistic people. So as part of that commissioning process, considering social care as a system has a tendency to pay quite low rates, and obviously social care as a whole is quite expensive, the council has to spend quite a lot of money on it. How is the council going to ensure that in that commissioning that the rates it pays ensures living wage for anybody who is working on those services that it commissions?
Can I bring you home to the question?
Thank you, Councillor Bishop. In all the contracts we have with our providers, we do stipulate that they must pay the minimum wage. So we have that stipulated in it. And we've tried as far as possible to go beyond that within the resources available. There was a number of exercises that have been undertaken during the course of the year which have given us information, and we're now working with providers that essentially bolster the amount of money we're able to get across. But we know through the contracts they do have to pay those minimum wages.
In minimum, where the council's policy for its own staff is the real living wage. So just
There's a several measures, I think, but again, that we need to be very careful. There are a range of measures.
also the living wage is actually a legal requirement, so that should be that kind of thing anyway. But I was kind of more saying about the council's own policy, which is to pay the real living wage to its own staff. We do. Okay. So for this commissioning, are you saying that that will happen?
That's the aspiration, is the higher, as you know, there's a real wage, minimum wage, so it's going to what done by boundary. So we are aspiring to pay as good at, the best possible level. Do pay that for our own staff, that's for what we commission. We don't have sufficient resources, we don't receive sufficient resources.
Thanks, Graham. The question, the point that you wanted to make around the recruitment, I think we already heard that. I think it was more of a technical sort of wording issue as opposed to trying to deceive anyone into thinking that this many people had already been recruited. So apologies that it was worded incorrectly, and we'll make sure that in any future updates it's very clear and specific. And I will also make sure it makes reference to as of this date, as of the date that the report is written, just so that, as already said, that these things are always moving and rolling. But also I'd be very surprised if every single one of them had been offered, decided to not take up that job, so that's on that point. And then 7.2, you asked a question around providers and the members within the ICP. What we can do is probably just send out the list of membership to yourself so you can see exactly who sits on the Integrated Care Partnership and which organisations they come from. That's probably should hopefully cover that. And apologies, the next question that you had.
It's a question of subsidiarity, because it's mentioned in the report, and I said it's a point was raised before, and it's subsidiarity for who? Are we meaning for the organisations and providers within it, or do we actually mean for communities and for residents being able to influence their local services, the health services? And which do we mean when we say that? Because it's been bandied around a lot within the founding of the ICS, the subsidiarity is a principle, but it's never quite clear who it's for. And for me, real subsidiarity would mean communities having a real input. So communities at not just Birmingham level, but down to constituency and even more level. And that is real subsidiarity. And my question is kind of to understand what you understand about that, and what the council is kind of working to try and push and implement in partnership with the other organisations involved.
I think sort of a simple sort of answer to that question is both. So the areas that you've described. So, my understanding and as reflected in the report is covering both of those sort of definitions of that. So hopefully that gives you the answer. And do you want to come in?
Just for clarity, just to add to that, I think it's helpful. There is the ICS, which is the broader partnership, ICB, which is the decision-making body for Birmingham and Solihull. There are then beneath that place committee, so that's part of the subsidiarity. On the place committee, we then are doing work really which is very much locality focused. So the answer to the question is subsidiarity right the way down to local communities. That's the aim and aspiration.
Thanks, and that's helpful. I think I'll make the point that particularly as you get lower down, looking at how communities, how councillors, how community groups, how residents input, particularly once you get below the place committee, is really important, and some kind of clarity and when it's worked out on that would be helpful.
Okay, and then the next question, the point that you made was around the cost of living response, specifically in relation to what the food systems team, how they've integrated their response and linked in with youth centres and young people within the youth centre and how they've been supported. I think it's been wonderful that we've been able to be in a position to not only just use the youth centres and different organisations across the city who have been since the pandemic and then even post-pandemic played a key role in dealing with the issues around food poverty in the city. I feel that the work that the food systems team have done in sort of securing the grant schemes to then further be able to benefit local citizens across Birmingham who have benefited from having that emergency aid, food aid available, as well as the infrastructure to be able to store food and equipment. But your specific questions around youth centres and their importance. I came from a youth centre background. I was a young person who got involved in, that led me to being down this route was because I was a young person who was engaged in the youth service in the council. I then went on to working in a youth centre. And I fully see the value of youth workers across the city who provide, amazing work into the lives of young people, not just in relation to things around cost of living, but just generally. So, in terms of understanding the importance and the value of youth centres, that is, definitely sort of embedded with me in terms of, my understanding and my relationship that I've had with the youth service as a young person, and then now as a councillor, and being able to see the benefit it provides for local residents. But in terms of your specific question, I wouldn't be in a position to be able to link that in with my role as the fifth cabinet member for health and social care, specifically to talk about any sort of future decisions. But, in terms of understanding and recognising that they provide, an amazing resource for young people. And we've been lucky enough to be able to use that as an easy way to access young people through the work that we do through the food system scheme, and then as part of the council's overall cost of living emergency response. That's really the sort of update that I'm able to give you here. It's not really for me to comment on any of the other points that you made.
The only follow-up I'd say to that, cabinet member, is that the decision, at least in principle, has already been made, because it was made at the budget last month from 2024, reduce the funding for youth services. And I suppose, and my point is, in your role as a cabinet member, as part of the administration, my plea would be, as I would say to any member, make sure that after a way is found not to cut that expenditure when it comes to the budget next year, when it actually will be implemented if it's put in. So I appreciate it's not your portfolio, but as your portfolio has demonstrated the importance and use of that infrastructure, my plea would be find a way to make sure that we keep the resources and funding for them come 24-25. There's a year to do it, so just and your role as part of that administration, that would be wise. And I get it's not your strictly portfolio. And thank you, Chair.
Okay, thank you. I understand Councillor Cole's get that to go there. So we've got 3 people who actually speak to confidence up. So if you can ask questions, which answer will have a very quick answers.
Thank you. First of all, thank you for your comments about local goods. Nice to know I do have some influence. I buy frequently. As far as Eurocities are concerned, we've been proud members of Eurocities, and I hope we will continue to play our part. You've only got to go into a supermarket to see that the United Kingdom is not foods sufficient, that we have to import, and anything that we can do to enable the food chain has to be good. Recruitment, I was talking to a chief executive of the trust yesterday, and it's one of his major problems. And I am concerned that whilst we may be paying the minimum wage, the living wage, we are being overtaken by events now. And if we're not paying the market rate, just not going to recruit, unfortunately. And that takes me on to care homes. I can't divulge the trust, but we as a city pay £600 per week per vet, and it costs that trust £1,000. So work that out. Everybody's running as a loss, and if we're not very careful, there is not going to be any social provision left in the city, and I'm very concerned about that, because it means that either providers will go bankrupt or it will be left entirely to self-payers. Place committee and localisation. My only concern is if we turn the clock back probably 10 or 12 years now to primary care trusts, which were based on constituencies, we seem to be going back to that. Now, the problem that we've got then is that we end up with delegates, not people that can make decisions. And we want decision makers at a place committee who are enabled to make commitments as far as their organisations, not just to be delegates to take decisions back to the head office. So it's a real problem, and I'll leave it at that.
Thank you. Thanks, Councillor Filthy. Chair, do you want me to do sort of each question or each set of questions?
Whichever way works for you.
Yeah, we can do all three.
Thanks. Three questions, hopefully. The first is to do with the Carers Hub. We've got a new Carers Hub, I think, coming live in April from your documents, an enhanced service or an enhanced resource. How does this manifest at a local level? big city? Is there a constituency contact or a local contact? How does the Carers Hub become a support resource for carers who've not often got a very small geographical circle for their kind of activities? Number two, we have got the younger people's support service now in the Neighbourhood Network scheme. This ties in, I assume, with the transitions to adulthood. This is a great step forward, by the way, but I'd like a bit more detail on how a young person who enters adulthood can then mesh into the support service that happens in the Neighbourhood Network System Younger Adults Programme. And I think there is always a question mark about the 16 to 18-year-old gap in the middle, so how we're handling that. And the third one, if you can, very briefly, Councillor Tilsley's touched on this. The Birmingham Place Committee is a citywide committee. There is also localities, pairs of constituencies, as far as I recall it, and within that, I think now called integrated neighbourhood teams, which then come to life literally in a neighbourhood. There's nothing in your paper about how we move from the Place Committee, the Birmingham citywide unit, through to localities and down to neighbourhoods. I think the secret to getting this to work in every community in the city will be for it to be live, as it were, on the ground. And I think that connection, I don't see how you've built that yet. So if you can very briefly give us a clue about how that side of it is going to emerge, I'd be very grateful.
Thank you. And lastly for myself, it's regarding the preventative place system and support for carers. So to build on to what Councillor Pocock was actually saying, I was concerned about the number of unpaid carers I know who
certainly coming to the end their caring role, and the person they care for actually passes away. What support is provided to them in terms of bereavement support and providing an ongoing valuable role for themselves. And then secondly, I know a number of unpaid carers who, when they come to retirement, find their pensions being impacted because they've not been able to pay full stamps or some people are just paying a hard stamp, and they've been hit financially through that. And then in terms, because I know you've got improvement when opportunities, I'm just wondering how you're actually working with employers to be willing to take on members of staff who do have caring responsibilities for adults. And then what you're doing in terms of, or what this organisation is going to do in terms of supporting carers who may feel socially isolated, because so much of the care they provide goes into caring for the person that they care for. And then the second question is regarding the technology-enabled care, and this relates to a family I know don't live in this country, but some of their concerns that they flagged up to me was that the people that are actually supporting them become over-reliant on the technology, which could potentially reduce the actual members of staff skills base. There's always a potential for a cyber attack and data theft if a lot of this information is being processed electronically. But from myself, the main issue has been in terms of the increased socialisation of cared for, because they're effectively being monitored by machinery as opposed to individuals. And there's also the worry about incorrect information being put into the system by accident. Yeah. And I suppose also there was a well-known, I'm giving their name outside this particular meeting, health technology supplier. And I'd seen an article by who was saying it does support actual carers in the home. And I'm not sure it actually does do, because having been a carer myself from a parent, you're actually there overnight. Regardless, even if somebody else is looking after them, you still don't sleep properly. So the equipment may be there, which would enable the unpaid carer to take that break. They know they can sleep. But I'm wondering whether that actually would happen in practice, because your body clock and your subconscious
will continue to be driving you to be listening to the person as opposed to responding to the machine. So thank you for the 7 questions.
Thank you, Chair. So the first sort of comments and questions are from Councillor Tilsley, and I think the first one around Eurocities is sort of to note, I guess. Yeah. And then the next one was around the recruitment and the major problems and the concerns that you raised, specifically around care homes and that gap, and then the providers then being impacted. I think I'd be more than happy outside of the meeting to have further conversations with yourself. Specifically, do you think that we can be doing anything better? But I wonder if there's anything around the work that we're already doing with providers quite closely that you might be able to comment on, Graham, just to.
I mean, we work very closely with providers. We've got an open book approach, so they know what our position, we know their position. We work very closely with them. You're right. For some elements of the market, self-funders subsidise them.
Yeah.
That's the reality of it.
Yeah.
Government's well aware of that. You know, the action could be taken, action should be taken, but we still await the reform to the Adult Social Care Service, which has been going on for the past 7 years.
Don't hold your breath.
Well, I think we've all got to that point, you know, but nonetheless, there needs to be action at a serious level. So we can do so much, as I answered to the previous question, in terms of trying to maximise the rates of pay being paid locally. We've used the money that came to the household support fund, those kind of mechanisms as well, to support providers. So we did everything we can. There is a market sustainability plan. And we will continue to work with our providers to stabilise the market.
Yeah, thank you. And then the next question, which Councillor Pocock also sort of followed up with, was around the place committee, and then from it being a citywide committee and not really seeing how the connection is sort of built down through to localities at sort of locality and then sort of the constituency level into neighbourhoods. I think it might be useful, seeing the interest that we've got from members of HOST, that we send something through like a briefing note on how place committees function, and it's sort of set out to operate, and then sort of in a practice to get a bit of an idea, because it's been important for a few times, so I think that might be good. Because then we've got something in writing to be able to look at that too as well, so we can probably prepare something for you on that instead of sort of talking through, and at least that will give you a bit more detail as well. And then the next question that you had, Councillor Pocock, was so around the carers hub, and then also I guess linking in with how it then manifests into a local level, whether it's constituency or not. And Graham, would you be able to talk a little bit about how that is?
I mean, the way we commission our services, as you're aware, we've got umbrella organisations like Carers Forward and so on. We then commission further down, so they would commission local groups who would do work on bereavements, Councillor Brown's comments as well, finances, etc., etc. All of those things would be picked up in that way, so people could contact a local group who would then be able to help them. So as well as a local group, there's also another dimension to it, which is that there are some of the work we do is really quite generic, and it's of general support for the informal carers, and then there's very specialised, for example, for carers, caring for people with dementia and need additional and specialist support. So it's done in both those ways to provide a kind of matrix. But again, it's a big city, so you couldn't run it any other way. You have to delegate it down and ensure that we've got good relationships with local groups who can then support carers.
So the provider organising, the umbrella provider organises this kind of local tier.
Yeah.
Nothing have a place on that, or is are they only just coming into being? Could we get a report back on how that works?
Yeah, we can prepare something, that's it. And then the next question that Councillor Pocock had was around the people support service within the M&S, and linking it with the young people from the transition into adulthood. And in a nutshell, yes, there is a view to sort of linking them in. And we're really pleased that the M&S services have now expanded into including young people as well. So it's an obvious kind of transition, especially within the areas through adult social care that they've got. So yes, to that.
Could we have that in more detail?
Yeah, no, we'll do. Yes, we can do, because by then there will be hopefully a bit more detail to be able to add to that as well. And then Councillor Brown, your questions were specifically in relation to unpaid carers and their role, well, the support that they receive towards the end of their role, whether that be through bereavement support or anything around them being able to get on with sort of work or any other support that they might need after that role ends. Would you be able to comment on some of the processes that we've got in place to build support?
Yeah, again, not right. But we are well aware of the experiences of care and the support of them. Again, like local issues up.
And equally the same with the employment opportunities, so we can bring that back as well in terms of tangible support that we share with carers who are either, for whichever reason, coming to the end of their role. And then the last one was around tech question that you had. Well, the concerns mainly, and we do already have a note that we've got under the current position that we're in with technology enabled care in the city. And I wonder again whether it makes sense to send something out just to give an update on, but also I wonder if there might be a view for HOSC to feed into some of the engagement work that's taking place at the moment in developing what that looks like.
And these questions are really good questions, but they're more easily answered in the time we've got available.
I understand
So we can come back. But the tech ones are really interesting because all the research happening, Councillor Brian tells me that carers benefit most from the tech, being able to care because of the assurance and so on. But I think you're right, there's a question about balance. At the end of the day, it's the fact that people engage in it. Generally, something they might engage in people as well. All people enjoy that human contact. But some of the elements, it's done, which is more time human contact that.
Thank you. I think that should be all the questions. I feel like there's lots of information that we need to come back to members with, but actually it's been really useful and helpful for me to come back as part of my initial first update back to HOSC to find out about where the interests or the priorities for members, at this stage currently lie, and whether that's in terms of just being able to quickly send something that's current and live and available to circulate that information. And I've made a note of all of the ones that I have said that I'll come back with. But then equally, whenever I'm next invited back to HOSC, it's helpful for us, or for me, to be able to see, when there's ongoing work. So thank you for inviting me, and then also for all of those questions, because it gives a bit of a steer to know what areas HOSC are sort of a bit more interested in, as opposed to just sort of bringing back an update on just the priorities that I outlined the first time I attended. So yeah, thank you.
Thank you for coming. Thank you for staying longer than you were able to be. Thank you for the comprehensive answers. It's appreciated.
Thank you. And apologies I have to leave you because I finished care of meetings and stuff. Thank you.
Are you ready for this? So, any recommendations? Okay, so I think we can move on to the next item, which is the co-produced review of the day opportunity. We've got Dr. Whitley, who's the Assistant Director of Adult Social Care. We'll introduce this item, then hand over, so I think, for Carrie Ellen McCartney from the Red Quadrant, and Sarah Scarley, Sarah Cusack, Jackie Nolan, Anthony Clayton, and Ian Tippott from the Empowering People's Team. Thank you very much. So over to yourselves.
Thank you very much, Chair. So just by way of introduction, in December 2021, Cabinet approved a report commissioning a co-production partner to review day services after the pandemic. And by April 2022, Red Quadrant were commissioned as the co-production partner to do so. One of the key points for Red Quadrant was to make sure that they recruited and trained a volunteer group of carers and people who use day services, and that's the Empowering People team. The report has been completed and is now with CLT. We're here to talk about the process of carrying out this review. We've got the Empowering People team who have all been named, and Red Quadrant with Linda and Paul. So I'll now hand over to you.
Thank you. Just briefly, what we were asked to do, a little bit more detail on what Tematopi said. We were asked to engage with a wide range of people who use day services, carers and families, providers and other professionals. We were asked to really drill down into the impact of the pandemic and what people wanted and valued about day opportunities, both during the pandemic and going forward, and what they wanted to change for the future. And for that to lead to a co-produced report to provide the foundations for the next steps in planning day opportunities. And that's the report Temi referred to. And the other string of what we were doing was developing this amazing group of people who've become the Empowering People team. So Paul.
Thanks, Linda. To make this happen and to make it happen in the way that commissioners have asked us to do it, which is a genuinely co-produced review of day opportunities, we needed to do two things. As Linda said, to recruit the Empowering People team, to support them to be able to undertake this task, and then was, quite frankly, a massive undertaking supported by John and his team to get out and meet people where they are in their day services to get their views. So these are people with lived experience, carers, but also the staff who work in those services so that their voice is heard. So we trained 14 people, got most of them alongside us today, and there was 9 training sessions with that group. And then they led with our support and support from commissioners 35 in-person and online engagement sessions. So really massive undertaking. 400 people attended those, 250 plus were people with lived experience and carers. And that report is now going through your processes. I'm just going to introduce Jackie and Sarah just to say a little bit about how they found that process.
Hi. What really did you like about the trial? It's quite informative, wasn't it?
Happened was and how we felt about looking like leading the engagement after the events. We was more confident, wasn't we? After we, the first one was a little bit all the best.
Yeah. I think the nerves got to us the very first one that we did, and then we sort of got our bearings and discussed what we were looking for, what we wanted to get from it.
Great. And Sarah, you led a carers engagement event. How did you find that?
It was quite informative, because I'm a carer myself and I work in a day centre as a family liaison. I was quite passionate about the things moving forward with what we're doing at the moment. So it was informative to speak to people that are in the same situation as me and share ideas as well of, how to go forward. That was interesting.
Yeah, it was a real discussion.
It was.
It was a real discussion.
Yeah.
A couple of hours worth, wasn't
A
it?
couple of people there that have suffered during COVID because they were sole carers to their people they were caring for. A lot of them were elderly, and I think that they struggled a little bit because they was isolated.
Yeah.
So the day centres really was the only thing really that was helping them along, because the day centre still works, but obviously we couldn't work closely, but we rang people up and, made sure that people were okay. And sometimes that phone call meant a lot to people.
Yeah.
So
it was so important for us to hear the actual experience of people, and to enable that to happen. We came together as a group to think about the questions we would ask when we go out to meet people in these sessions. And Harris is going to say a little bit about that process.
Thank you, Paul. Of course, ourselves and Red EPT and Red Quadrant, we came together, and as you can see on the screen, we came together and we agreed to what questions we will be asking at these events. We also worked together to adjust the questions for for different audience, and we had some feedbacks. And if the questions were a bit difficult, we would make adjustments.
Yeah.
And it was when we came together that day, we agreed and we wanted to have an identity for ourselves.
Yeah.
And when we were going out, but also an identity for this group of people that will take this work going forward. And that's when the group came up with the Empowering People team. That's what they wanted to be called and be seen as. And for that to be a legacy from this group that will continue.
Yes, absolutely.
Thanks, Harris.
You're welcome.
An important part of this process was to think about the future for day opportunities and to get the voice of people who might not be using those day services now, but will be in the future. So Anthony led some work around that. Anthony, do you want to tell us?
Paul. I went to 6 special schools and colleges, and what we wanted to find out is what their plan was at the end of school and college. So the transition from one thing to the next, and what things could be put in place to help them. And me being honest, there wasn't actually much said from the teachers and at the colleges and schools. There wasn't much said.
There was some important theme, some of the people who you spoke to about the importance of having an education. Seeing a future where they had a job or volunteering, being part of something and being respected. They wanted to have a purpose and have some role. What was there also something about the anxiety of that transition into the next stage of their lives?
I think that they will find it hard to transition from one thing to the next, because of obviously of what they are, having additional needs. It's hard for them to transition from one thing to the next.
And it's also hard for their parents and their carers to think about that.
Yeah.
Brilliant. Thanks, Anthony.
Thank you, Paul.
And just thinking about the next steps, we all came together after the events to reflect and share what those key messages were. Those have been incorporated into the report, but also to reflect about what the next steps should be. and they were very clear about those. And we have the group from Cerebral Palsy Midlands here to tell us about that. So we've got Amy, Lawrence, and Ian who just have something that they want to say.
Apologies that I have a speech impediment. We have actually been involved, included in the co-productive process. It has been very worthwhile. Working together has got to be the way forward for us all. It has been a valuable and rewarding experience.
Brilliant. Thanks for that. And I think that was unanimously the view of the Empowering People team. They valued the work that they did, got a lot out of it for themselves, but it could also see the potential for the future, and they want to still remain involved. Brilliant. That's been the experience, and we're happy to answer any questions.
Thanks, Richard.
Thanks, that was really great presentation. Thank you very much. So just, hopefully fairly straightforward questions. You guys, I think, at Empowering People team, I'm curious in terms of, are you people that have been involved in things like this before? Is this the sort of work that, or have you kind of involved in any sort of advocacy or standing for kind of your services or rights before, or is this completely new and this is the complete first time you've done anything like this? So that's my first question. So it's how the team was kind of found and recruited, where you know, kind of how, what methods were used for that. And finally, the mentions 400 people and 250 were carers and service users. I'm curious what the 150 were, others were. If they were carers and service users, the other 150 engaged, who were they?
Does anyone want to say whether they were have been involved in things before or not?
Well, me being honest, the Empowering People team was brought together because all of us have been through something and we've had to transition in a way. So that is how the team comes together.
I think it is also, I think it backline. It was sort of support dissect us to other opportunities of what people would bring to the team. So carers, staff, people that are in the middle of what's going on and things, participants in day centres, people that don't want, you know, they don't fit the day centre boxes, they want to do some kind of work and things like that, but they can't do it on their own and independently. So there's a big range of questions that we sort of got asked from other people that came to these meetings, and the meetings were, I think all the people that came to the meetings were carers, there were staff, we went into day centres, we went into schools, so we had a carers meeting, the one that we did, there was quite a few carers there, asking them what their experiences were in like COVID, and from COVID, you know, what have they got in place now for if ever there was an event like that happen, and sort of learning from things, wasn't we? Learning from people's experiences to gather information. So I think everyone that was involved, that we asked questions for, were people that have had some kind of experience with special needs, learning difficulties, additional needs, really.
The opportunity was advertised across all the day services. So we were open to whoever wanted to be part of this. And I think there's a genuine mix. Some, like Aris, have been involved in sort of voice exercises before, but others, absolutely, this was a new experience for them. I would say the majority, actually. Sorry, Tim.
That's fine. Could I also bring John in? John, maybe you want to say a bit more about the team and some of the other teams that we have on advocacy like the
Yeah, John Freeman, Commission Manager, leading on this work. We've previously done some co-production back in 2018, 2019, looking at issues around accessibility across Birmingham and developing quality assurance to work with our external day care providers, partners. So those people who are still using those services, Jackie included, were invited to take part, but we also wrote to all 48 providers, including councils' day centres, but people based in something like 70 centres across Birmingham and across the board, since Solihull and Sandwell. So they're all given the opportunity to, well, they were asked to share invites, written invites and easy read versions of things with their people who use their services and their family members to say they want to be volunteers. Once they were recruited, so we managed to recruit 14. There was a no interest, but then there were practical issues that they felt couldn't be managed. We set up venues, we did all the transport booking, refreshments, etc. Training sessions took part. And then we decided, because of it being winter, it was going to be sort of late October, November when the review took place, that because of the risk of winter infections, flu, COVID, etc., we would offer the opportunity to go into day centres rather than asking people to transport more vulnerable citizens different places across the city. And as Paul has said, we did 35 events in various centres and public events for carers and professionals, venues across the city, north and south, west. We did all practical arrangements to make sure they were as inclusive as possible, so that if anybody got particular needs that they needed supported to get to a venue or whatever, then those were met. Yeah, fantastic experience. I get the opportunity to do it again would be would be great.
Thanks so much. Mr. Harrison, do you want to say something?
Yes, I will. Yes,
I've worked within this sector for over 23 years, and I've worked at St Paul's Midlands that long. And what was really beneficial was this was impartial. You know, sort of there was no, even though you did the practical arrangements of things, but it really was sort of the voice and the co-production. And as Ian said, working together. And I think it was, you know, it was quite very valuable. What came out of it was not really being influenced by anything else other than the services and the people who, you know, who were meant to be heard. And I think that succeeded.
Thanks, Gary. Harris.
I would like to add, this is all new to me. Like, of course, with lived experience, I am autistic also. I'm so greatly honoured to work such alongside great people. You know, we had the opportunity to go out and speak to these people, like how Anta said. We both come from another place, the Yes Group Youth Empowerment Squad. And of course, I remember meeting the guys at the very first time, getting all together. We were quite unsure what we were doing, but of course, as we went on, we started to grow, and EPT came about, and I'm so proud to be alongside such great people. So, yeah.
So can I just respond to that last question about who the other 150? It was really important that we met people where they felt comfortable with the support that they need to be able to express their opinions. So we're really grateful for the day services who enable their staff to support the people attend. So often there'll be people who need one-to-one care because of the disabilities that they have. So that at that 150, there would have been a lot of those people who enabled those people to have the voice, as well as the professionals and day services staff. Thank you.
Thank you, Chair. One of my questions was about who were the other people on 150. So that question has been answered. So I do like this report because I was very sceptical when we were doing the previous briefing about this. Co-producers often the word that's bounced around, but it's good to hear some of the feedback to speak that actually has been very, very inclusive of service users and carers, which is what we want it to be. And certainly, over 400 people attending a number of sessions far exceeded what I expect this process to produce. So that's very, very good. So I feel, particularly the experiences here today, from those who took part in that, I'm confident that we have done a good job. I suppose my question is around, are we sure that of those 400 people who fed in, is that because those who need care as subscription or provide care, that's quite diverse? There's a lot of different needs, a lot of different circumstances. Are we sure that the feedback that we've accumulated as part of this process is reflective of Birmingham and the diverse populations in Birmingham and those diverse circumstances, and it's not overly weighted by one group or another? To ensure that, because I know, they say Birmingham's a super diverse city, and I just want to ensure that we are pulling all those strands together, particularly as this should in theory shape future service delivery. We want to make sure that we are having all those voices heard so that they can be considered. So I want to just make sure that we have picked up the diverse nature of Birmingham through this. And then my next question is what happens next after this? Because I appreciate, we've had this update as to what the process is, but I'm very keen to hear about what did those people say during those meetings? Because, the idea is that that's meant to shape services. And I'm certainly keen to ensure that as we go through this process, that the service that council wants to produce is reflective of what service users want and need in Birmingham. And it's not a top-down approach that the council's done before, like shutting day centres, which I know will be a concern. And certainly the experience I get as a councillor is people very worried about the future of day centres and buildings closing. I appreciate that's not for everyone. There are some who don't like or feel that day centres aren't suitable for them, but there are many who do from the social benefits it provides. So very much welcome the report, but sceptical for what the future may offer on that. So, and I appreciate that it's outside your jurisdiction, that's not the council. So sadly, the cabinet members there, but Graham still is. So I'm hoping that he will take that on board. So, but just if you can answer that around the diversity point to make sure that's been picked up, that would be useful.
We did our best. We can't say that we absolutely included absolutely everybody, because there are probably some people that we didn't get to. We went to as many day centres who were willing to host us. These guys had lots of links into the community, and suggestions were made about where we went. And as John said, we had a public event that was an open invitation to anyone in Birmingham who had an interest. I think, as I say, we can't say we got to everybody, but what I can say is that there were some key themes that have come out that are in the report that were consistent across everybody that we talked to. So we talked to a really diverse group of people across lots of different centres with lots of different day opportunity experiences, and the key messages were consistent across the board. So I would hope that actually there isn't a group of people somewhere in Birmingham whose priorities were so much different to the rest of that diverse community that we've missed it entirely. And in terms of the report, John, please.
Just in terms of the sort of diversity, what's interesting to look at when you look at the profile of the day centres that are citizens used, the ones that are very culturally and ethnically specific are all in the older adult sector. So there were review sessions held at Chinese Community Centre, and at least two of our specific day centres that specifically support people from Asian communities. So their voices were heard in the context of that. Of course, across the wider landscape, we went to sessions held in day centres where people have very, very complex needs, and those where people are far more independent in what they can do and engage with. So we had a good mix in that context, but yet there's a lot more that moving forward we will try and engage with.
Just in terms of your last question, I don't think it's that far. This was the article that goes to cabinet in April. There are key recommendations from the report that will be shared there as well. One of the things that we are really consistent on, and that we are going to make sure it happens, is national road co-production. This is the consultative piece. The golden thread of this being co-produced will continue in terms of the strategy going forward for day services, as well as any other strategies that come out of that as well.
I appreciate it's got to go to cabinet because they're the executive decision-making body. Is it going to be brought back to this committee so we're informed as to what the findings were?
We could do so, yes. Yep.
Councillor Pocock.
Yeah, following on from Councillor Moore's point, I support fully what he said about the need for us to look to the future. Can I congratulate the Empowering People team? I think you've done a great job. You've got a future ahead of you. I think it's clear as this service develops. I like the first comment on the top left. We want to know what happens next. We also, as councillors here, want to know what happens next. You share your aspiration here. Well, I think if I can presume 2 points, you can correct me if I'm wrong. From the work you've done, I would imagine there is a continued support for the strength of day centres, and there's also support for things to be done outside day centres. So both pillars, I would imagine, form part of the work that you've done. I appreciate you can't preempt the response, because it would be helpful if we've got the right message here that this is the steer that's going forward to strengthen the day centre function where it works for people, to strengthen the other opportunities and activities outside of the day centres where people want that as well. If that's the message, then I think it's an encouraging one. I do think it'd be helpful, obviously, to see the report when it goes to Cabinet. And I think it will be good. This will clearly start a further process of development for the service. So I think it would be good to get an update from the officers on how that is going to work, and also an update from the Empowering People team about how you can make sure that what we do in this city makes what you believe people who benefit from the service want to see. So I think if we can keep those two tracks going, we'll all be happy.
If you'd like to respond to that.
Thank you. We'll definitely keep that in mind. You mentioned those two pillars, which Linda talked about cross-cutting themes across all of these, and these things that came out about the importance of those services and thinking about the community as well. So those are two things that we bring it back to here, and in fact, sharing their experience.
Thank you for that. The question itself is about what the Red Quadrant does undertake four tasks, one of which is designed to group people with whatever experience and carers to be co-produced to lead in the review and support the future activity. Is anything lined up in terms of future activity side? In terms of where this particular group will go to?
Being the parent team is involved.
Pardon?
Do you encourage the
Yeah.
What we said, so there was a last session where Red Quadrant then even have findings from PPC, the items of the social council. And one of the key things that came out was that PPC wanted to be part of everything that shaped going forward, and that's something that we're committed to doing. But it wasn't just a one-off piece or a token piece, that they definitely be integral to make steps going forward.
Okay, thank you for that. Anyone else, any questions? Okay, can I thank you all for it's been really informative. Thank you for just with that. That performance monitoring, Graham Betts is going to be attending this item. He's going to be assuming that members have read the report, and we can go straight into questions. And we've got about 50 minutes for this item, so.
Question members.
Just to get the ball rolling, proportions of clients reviewed, reassessed or assessed within 12 months continues to be red. That seems a little upward tick. We've got a way to go, so can you update us on this? And while doing it, it may be tangential to your report. Day centres currently not quite up to what they were before COVID, or are we back to the normal level of activity? It is a separate question, but I thought I'd ask it when I was giving the floor.
So, my
apologise for that.
Right, let's just unpick the issue of the reviews and so on. I think the key thing is when you see this slide, if you're on the same one as me, which is the one that's in more depth in the commentary, that, as you say, it would look as though it's just going marginally up. You know, but what I think you really need to understand is the context for this, why we got to that low point, which was optimal.
Why will therefore not be an easy or quick process to get it back up to where we want it to be. And you know, I mean, it seems, well, I say, no, it's not still harking back about that bloody pandemic. We've all moved on. And, you know, life has in a lot of ways, but in reality, actually, it really did cause a huge problem because we had to prioritise the workload. The priority wasn't to review people who were in a care setting, it was to deal with people who were coming into care settings, and that's the reality of it. So when you reprioritise work like that, it inevitably means your performance somewhere in the system is going to be affected when it was reviewed. So we didn't stop doing reviews, as you can see, but we reduced the amount of work and put the priority onto people who were coming to the front door, so to assess the needs rather than reviewing people who were in the care system. That's the first point I think that we need to be mindful of. Then the second thing, and we touched on it earlier, is the recruitment issue. The whole of the, you know, it's not just this council. Up and down the country, health and care systems are struggling to recruit staff. That's the reality. It doesn't matter where you look, there isn't any good one. GPs are in a similar position, you know, therapists, that's the reality that we're looking at.
Retention is
So, you know, it's just our level best, but there is vacancy rates now. In social care,
bus drivers, nurses.
You can't do everything you want to do when you've got 15% fewer staff to do it. It's just the reality. So I'm not proud of this, and I'm not trying to make excuses. I'm just saying that's the backdrop in which we've been managing. So if you look at our performance, it did drop and it did go right down, as you can see. The good news is we've more staff coming in now. Stopping the flow going out, we have got more people able to do reviews. We've become better. We had to also target direct payments because they're the most risk. I mean, would I review someone on a direct payment or would I review someone in a care home? It's pretty obvious which one's going to be the priority is the direct payment because you don't know what's going on. So you need to review the care home, you know, the system, structure, reviews, all of those things are in place. So that's why we had to then prioritise direct paying people. We've done a lot of them to get them through the system, and that's why we're now beginning to see the figures coming up. The good news is that I can't need to take my word for this, is when you get the next quarter, even better. So we are now seeing a steady, not just a big uptake, but a steady improvement in position. And in the latest figures, we're back to where we're now above where we were last year at this time. So I think, you know, to give you some reassurance that we've got a grip on it, you know, the team understand, we've got targets and we're now delivering sustained increase.
Just explain that clearly.
Pause on that and then I'll come back to you. Is that okay?
Yeah.
So back to the day centre. I've described a lot of different people. I was at a day centre last week, looking at what was going on. And you know, what was really brought home to me, because it was quite a small setting, was how many people stopped attending. Some because they died, because they died of illnesses in the country, don't treat problems during the pandemic. Others completely lost their confidence in coming to the day centres, and others couldn't afford it because of the cost of living crisis. I mean, I don't know, you know, I keep, you know, you get fed up and on, and just say, that's all you do is put in a blue company or something, and it's just the reality of the situation. So the numbers are down, for sure, that's absolutely the case. And, you know, you have to have concerns about whether there's no back on it. People lost, you know,
Still careful, aren't they?
So it's going to be a real challenge. And I think the views that we just heard about, you know, just a few minutes ago, is very tightly helping us. I think that we need that. When you're looking at a centre that's literally half empty, that's got to be part of this thing. It's a real challenge. And I think, you know, most Anthony and most that group, there is a group of people who co-produced in the Yes group, and they're very much, you know, in a different place about what they want in terms of their opportunities. It's the younger group. So we've got a really difficult set of decisions to take, I think, which is making these people who are in the system, are elderly users of services, we need to continue to support, but also being very mindful of young people coming through the system who've got different ambitions, aspirations, and so on. But at the moment, you know, the numbers are significant. The worst is about half down, the others are fairly better. So yes, the numbers are.
So you mentioned the numbers, Claire. Is there a report or some data that could be made available?
Yeah, we can send that.
Thank you.
As long as it says it, yeah, I'll get it.
Thank you, Councillor.
Thank you, Chair. So my first question was in relation to number of adults over vulnerability and active disability aged over 25. It says there that support was below target. Factors include further education institutions being closed over the summer. Now they close every summer, so presumably there must be some sort of support mechanism we can put in place to address that problem moving forward. That's something I assume that we consider as an option, because it seems a rather strange factor to highlight when presumably there is something we can do about that, finding some sort of provider or working with the colleges so that they can provide the support somehow during the summer holidays. So, because it's something that's going to happen on an annual basis, so relatively more simple to try and put measures in place to address. So, is there anything being done to try and ensure that these people who we need to engage with are being supported over the summer months rather than just accepting that colleges closed during that period? My next question was around the safeguarding aspect. So obviously we're above our target, which is good, but in the commentary it talks about there's a large volume of cases which result of an existing backlog and unusually high referral rates. We're slightly worrying if there's a backlog with safeguarding inquiries. Are we satisfied that that backlog isn't impacting on anyone's well-being or safety? And I assume that we will prioritise or triage those complaints to ensure that anything which is of particular seriousness not sat on someone's desk waiting to be looked at. And is there a reason why there's particularly high referral rates in the summer of 2022? Because it talks about there was unusually high, but doesn't give any reason for that. So I'm just curious as to why there was that summer was particularly high. Is it because everyone's out of COVID by then? Other reasons? So it's useful to know that. I mean, just going back down to the constituency breakdown, it's a bit of a hot one. Quite interesting to see the discrepancy between different constituencies, but also that it wasn't just one constituency was doing better or worse than others. It's a real mixed picture. So is there a reason why there isn't that level of consistency across there? I mean, there is slightly more on the safeguarding outcomes, particularly where my constituency of Erdington is at 79%, which seems quite low compared to the other worst performing. So is there a reason why Erdington is particularly poor on its safeguarding outcomes than others? But and are there plans to try and have a more consistent approach across the city?
Very much. On the first question about it's essentially the Stewart project. I think we have to put that in the context that that service is going to be majorly affected by withdrawal of the European fund. And so we are in a position of having to run that down, whether we like it or not. So that's the backdrop to this service. And I think you're right. I mean, we do summer comes in every year like that, but the project's only been running for a few years. There wouldn't be anything like this going forward. So we are going to have to fundamentally rethink how we organise it in the summer period. So it's really just giving us a chance to think this through. Because if we continue to run the project, which we hope to do, we'll make it part of that. I did think before. No,
on the issue of European funding, there is a funding pot to replace European funding. So I think it's called shared prosperity. I'm not sure I may be confusing it, but there is a funding pot available. So presumably, is that being explored? So it's not specifically to continue projects.
The issue is,
I'm not. No, I think the idea that it's EU funded, therefore it has to come to an end. I don't necessarily accept that argument.
No, I don't either. When we're looking at it, like to continue, obviously it's being drastic measures, but we're going to get that attention from the funding we used to get. That's what I was saying, going to have a fundamental rethink. But I mean, I take on board your point, and we'll feed that into the rethink about anticipating things and how best to get involved. There is some good wisdom there, I would suggest, but I think you're right. With the long term guaranteed funding, it's difficult to really plan. But it's a good service, it's a key service. I'm sorry. The next one, on safeguarding. The thing with the measure on safeguarding, the key thing here is this is what we're trying to measure is really personalisation, because even in a safeguarding setting, we should be able to provide people with the outcomes rather than just an answer. And that's what that's reflecting. The trouble is that in reality, the numbers behind us are quite low. They do fluctuate quite a lot, which is why particularly for some areas you mentioned, some of the constituents, the numbers are much more involved. And when you take a cost revenue, you get these kind of figures. But in constituents, the numbers are really involved. That's the issue there. The key question we were asking is about the backwall from the storm. We did have a significant backwall. We built up against some of these. Wanted to try to be able to use in a much better position. I've got that backbone. We write it down. And you're absolutely right. It's not an unknown backbone. It's an unknown backbone. So we know this oil. We know the people are safe, but we can wait. That's the moment for the other side. I know that situation. So yes, a managed backbone. Reinsurance and that. Initially, the numbers are much lower, in a similar position. The moment was bigger than worse. Safeguarding. The constituency, when you're right, I would have to look for some sort of rhyme or reason in it. I'll push to find it, if I'm absolutely honest. I think the one thing that I would say is that if you take, say, 10%, which is about a significant, base, it's a significant figure. So if it would be more than 10 or higher than 10, you think, why is that? What's wrong? Most of the figures were within that range. So I'm not saying that there was all consistency. I'll come on to that point. But there wasn't any wild things. Just one or two were a bit extreme. Was how I felt looking at it. And as I say, you can't begin to explain that just in terms of the minute you begin to drop into constituencies or teams, the numbers get smaller and more volatile. So what's impacting that, I think, is a good question, and it's one that I was looking at myself with that in mind. Certainly, you'd have to say demographics could be an issue. I mean, even although Bunting is pretty much universally poor and deprived, there are variations within it. There are certainly different take-up rates between different ethnic groups, which we're exploring, and that's a particular concern for us. And then again, then you mentioned age as well, because it's not universally a young city. There are areas which you have significant elderly population. So demography is certainly a factor. We did try to weight the teams to take account of the levels of need, but in my experience, that's a very difficult thing to do, because need isn't just numbers or just age or just, what I mean, there's a whole range of factors, and it also is highly dependent on other services locally. So if your NHS services are poor, you will have a greater demand on social care services. If housing services are very good, it's just the way it works. So there's certainly that. Then there was staffing issues, and again, some teams, as you can imagine, are hit. They're jogging along really fine, and then a couple of people leave, a couple of others think, I'm not going to, Jeannie's going out, I'm going to well, and before you know where you are, you're doing 4 people and you're struggling. So there's a range of factors like that. Now the real issue, which is what you alluded to, is this a desirable position? No, I would rather have more consistency as well. And that's what John Williams in particular, who leads on the constituency teams, is trying to do, to bring that degree of consistency. That is a much better picture than when John first started looking at it. I have to reassure you about that, because I remember saying to John at some point, why is that team twice as bad as that team, John? So he's beginning to pull it in to get a more consistent approach. It'll never be entirely consistent. And people that work in social care know all the factors that can influence it. So you'll never get that level of consistency. But it's worthwhile aiming for it, because we shouldn't be in a position where effectively creating a sort of postcode lottery. We talk about that often in the NHS. It happens in all, local government, all public sector. We need to really be careful about that. So we are giving it a lot of attention to get greater consistency of approach.
Chair, I think it would be useful to have some commentary around the breakdowns, particularly for me. 79% is significantly low. It's progressed. Most of them are in the 90s, but all is 85. 79 is significantly lower than the rest. So that definitely seems like an outlier. It's strange for Erdington compared to the review in the last 12 months is actually higher than some of the other city ones. So I assume they're different teams, but one seems to be doing better in one constituency than another team, presumably the same constituency. So I appreciate there may be factors, for example, if a particular team's affected by a lot of staff leaving, then that is going to have an impact on the numbers. But I think some commentary to explain some of the outliers might be useful, because it does just seem very strange. And I appreciate your point about the demographics, some of that around care at home, direct payment uptakes like that, very based on the service user effectively. But some of this will be stuff that's within our controls, the council, like reviewing the care and conducting the safeguarding inquiries. So I would have preferred to have seen them much higher, some of those figures. So, but I think rather than just having a table of lots of random figures, because the rest of the report does have a commentary with it, but for some reason this one doesn't. So if there's a reason why some staff have left the Erdington team, which is why the safeguarding inquiries are lower, it would have been useful to have that in the report rather than initially thinking, oh my God, what's happening in Erdington?
And can you also break those figures down in the constituencies into wards as well? It could be there are specific wards, is that possible?
I think that would probably be stretching it a bit far. The reason there is their commentary is this isn't a report we normally bring to the science. The first thing, it's welcome. I said it's welcome. It's new. It's new, and that's fine. But we can. It's something that the committee are interested. We can build on it and bring a commentary. And again, I think one step figures. Again, what's important is we look at the trend. We just look at. At any point in time, if we put it on the table like that, next what page earlier in the following, we find something else that will go into the top of it. So better than the trend. So this is something that the committee is interested in. We can build this into a more regular report in different ways, and then add a commentary, for example, why everything is important.
I think it's back to new pieces. I think we need to give that opportunity to them to see what their variations are across the constituencies.
Thanks for the report. Just, a few quick ones. So that for measure 6, do we have any idea what's driving the kind of downward trend of direct payments? And I'll take your point, you just said before about trends, but, if that is a trend, then do we know why they're kind of going down, albeit slightly? The safeguarding measure, which obviously looks good, but I was wondering about the number of kind of inquiries that had not been responded to with a section 42 safeguarding inquiry. So do we know what that is? How many referrals did the team receive in total? And then of which those then, safeguarding inquiries made? And measure 1, another way of kind of putting that is 30% of those assessments are not being done as they should be. Are you able to just put that in context of where that places the council in terms of legal duties and in terms of care rights and so on?
Okay, so on direct payments, I think we've been basically bobbling about that kind of figure amount for most of the year. As you can see, it really doesn't change an awful lot. And where it's gone down, it's actually still higher than it was in Q4 last year or from this year. So it's very marginal. The numbers are very slight. And I think always to remember, any measure like this is what this reflects is the numbers exiting and the numbers coming in. So that's part of the reason. Personally, I think we've plateaued. I think this is being the current approach we've got. This is probably as good as we can get it, because it's been like this for a long time. So I'm not sure that we could make much difference there, and particularly given the emphasis we've put into reviews, which was a more pressing issue. We are having our meeting, our management team and the wider management team are going to have a look at DPs to see what we can do. We are one of the best in the country. Again, relax a lot more boring or anything, so don't take it out of it. But again, if you're actually in top quartile, you have to build on that thing. Is there anything else at the moment? Like we build the reviews one job. Yeah, so we think we need to improve, but we think we need a step change. What you probably would be aware of is when I arrived, which is a long time ago now, and DPs were one of the worst. And one of the things we did do is do a co-production exercise, and that helps us understand what really needed to change in staff attitudes to do more DP. And that's testament to that involvement in service users and carers and so on.
So we're going to have to take a fundamental review, revisit the direct payments. I think if we want to get from where we are about just shy of 40%, 50%, we're going to have to do something different than what we're doing. So that's really where we are. And then on safeguarding, I have got those figures obviously not on me in terms of all the breakdown. So those figures are all reported into the safeguarding board, the adult safeguarding board, so they are readily available. And again, if you would like them circulated to, I think that would be valuable. Yeah, again, just if it's going to send it out, and that'll give you the entire picture. As I say, that measure is specifically about personalisation, and that's what it's trying to demonstrate. And then in terms of reviews, in terms of the Care Act, we should be trying to review everybody once a year. That's the aim, and that's set out in the Care Act. In reality, very, very few authorities are in the 90s. Even to do that, you'll never do 100% for obvious reasons, which includes people not being available, their care needs falling over. If you look at the reviews done within 18 months, which is a more realistic time frame, the performance that you would expect is better. So our aim, and that's why we're driving forward on improving the reviews, because we're short of where we want to be. The target's 85%, which is achievable and a reasonable target. That's what we're aiming to get back up. Then, but that kind of figure is we're closer to that when you look at an 18-month period. And I'm not just saying that to make it easier for myself, but it's just being realistic about getting people reviewed within the timescales they set. So
Okay, a couple of questions from myself. In terms of the direct payments, as you said correctly, I think we've been hovering around that 38% figure for a long while. How do we compare to the other core cities in terms of direct payments? And secondly, relating to one of the points that Councillor Pocock made a few minutes ago about people that are no longer using the day-to-day daycare because they feel they don't want to do it anymore. What support are we providing to their informal and family carers who've now got these people with them for significantly larger periods of time than they had previously when these people cared for and they've been going to daycare?
Okay, thank you, Councillor Brown. So in terms of core cities, I think we're very favourable. I can't remember off the top of my head, but I have had a look at core cities performance rather than just national because it's a more reasonable comparison. And we do very well in the course when we compare ourselves to core cities on direct payments. We are, as I say, we're in top quarter nationally and amongst core cities we're the best, or second best as that. But we do very, very well. And the other question, next response to that, a lot of during COVID, in the aftermath of it, and even up to now, I mentioned some of the day centres I've been visiting. Before people might not come, they still keep in contact and keep in touch with them. We do try and support carers in that way. Some of our day centres are offering, home spaces, things like that for carers as well. So we are trying to keep in touch as much as possible. Some of the people, when they died, the carers then were released from that. So they wouldn't keep in touch with them necessarily. But in answer to earlier questions, I would expect, those local groups which are part of the umbrella for carers to be picked up in that way. But I know for a fact some of our services are still in touch with carers, even though they care for no longer.
I've seen the possible cases where if I'm caring for somebody and my cared for doesn't want to go to the day centre, they're probably not going to want to go to a walk space, which would give me a break with me. And I don't want to leave them at home by themselves because I'm worried about them if they're by themselves. So I'm just wondering, and it's probably a very difficult question to actually answer. But I suspect there must be a reasonable number of carers who are almost who are quite social and isolated, often that they're looking after their cared for, who used to be in the
Yeah, I think that's right. I mean, it's certainly part of what we're trying to do through the neighbourhood network. Is to put in place more of a safety net. That that's why we dropped the age group in the school and just have it as well. Do that in kids. That's the lived experience.
I've listened to the comments that have been made from my own experience. I know that pandemic has knocked the confidence of a lot of people very, very badly, to the extent that if you are suffering with a long-term condition, you are more likely to stay at home because you are worried about picking up somebody else. And, my interest around long COVID has got very, very similar symptoms to ME, chronic fatigue. And if you've got ME, chronic fatigue, and then you get COVID, you then get long COVID as well, which is what. And it really is a situation where people's confidence has been knocked across the board. And I don't know whether we will ever get that confidence back now. And it really worries me because people are being isolated. And whilst welcome the comments from the carers report. That is predicated on people being able to come together and not being isolated, and that really is my concern.
Okay, thank you, and thank you for,
That's a tricky last question, very quick.
okay, I think that just.
Yeah, I'm
We have a
spoken.
question, but that's just very brief, yeah, from both.
I mean, we can't have a ward breakdown, that's clear. Could we have some absolute numbers of clients or users, service users? And is there any indication as to what condition or situation has brought them into being a user, whether it sort of medical, physical,
Or other social care in general? you think?
well, no, on the constituency breakdown. But I mean, initially, yes, just the absolute numbers.
Numbers is it looking at?
Yeah, okay, that'd be useful.
What brings people in? You have
Yeah,
to, you have to review the care record. But the
Yes, okay, yeah.
Sorry.
Perhaps I'm being a bit too pernickety, really, but I was just wondering whether, I mean, we do get health indicators for our wards and constituencies, and obviously respiratory issues are a big thing, certainly in Ladywood Ward. I just wondered whether that tied in with the service users in the area.
It's a vast bulk of people need social care with a disability.
Yeah.
Or
Yeah.
age-related disability, or another category of tasks to deal with. So really, that's the key area.
Yes, yeah.
That would be why most people come in. A lot of people come via the health services. You're absolutely right. But when, in a sense, we didn't break our information. But let's start with numbers.
Just the absolute number. Yeah. Or would that be number per thousand of the population in the constituency as well?
We could get some clever.
Some kind of indications to whether, people in Erdington are in more need than elsewhere, or vice versa.
You're fine, but you look at the absolute numbers, they do vary quite significantly, like quite many.
Yes.
But if you then standardise it, then times in the population, I'll give you a better feel for how we respond.
Yeah, it's just a quick one. We had the director before us on the subject of performance. 6 years ago, you gave a very impressive presentation about transforming adult social care with a vision statement, where you were very candid. We've slipped right back down to the bottom of the league table. My aspiration is we get into the top quartile. So overall, do you think we are in the top quartile, getting near it? How would you sum it up?
Well, again, it depends on the basket measures. I think one of the key things that we aspire to as a city, which obviously was cabinet vision and so on. I think in those major areas we've achieved what we set out to do, and reduce the number of people going straight into residential homes. We've improved our performance in enabling people to stay at home and not have to go into hospital. We've increased people's independence in that way. We've also increased the whole personalisation agendas with direct payments, safeguard, and so on. So against those key ambitions that we set out, we've come along with it.
Okay, thank you for the question, members, and thank you, Councillor. Sorry, Greg, for your answer to the question.
Promoted.
We might swap the other one.
Yeah, keep it brief because I'm conscious that a little bit on the schedule. The next meeting of this committee is the 18th of April. The items on the agenda for that meeting are a report from the ICB and then a follow-up report on the immunisation report And for the ICB report, given the discussion you've had, whether you want us to ask for information around subsidiarity and the place committee, because I think you haven't really provided from a perspective, but that might want that directly from the ICB.
I think it's also the lower levels as well, the localities. Really, that's what,
Yes.
decision-making power again.
Are they able to send officers along who have got decision-making powers? That's important.
Yeah, but I think that tips into the governance as well, decision making, so where points that out. The other thing I wanted to flag is on the 5th of April, the Education Children's Safety Partnership meeting and the Birmingham Children's Safeguarding Partnership were attending. So members of this committee have been invited to that meeting because that links to the inquiry on children with mental health. So if you have that, well, you should have that invitation in your diary. If you're able to attend, that's the purpose. It's the thematic of the inquiry. The other thing I just wanted to flag is the joint cost meeting. And this is to expect all the members of this committee. The joint cost meeting committee met yesterday. It's been agreed that that committee will meet again to consider the Berwick report and independent review into UHB, which will when that's been published. So the date for that hasn't been set yet. But in principle, it's been agreed that meeting will be hosted by Solihull. So we'll keep people up to date with that. And then the other thing I just want to flag, I've discussed this briefly with Councillor Brown, but during the meeting, there are a couple of emails have just been popping through about the quality accounts, which is the annual reports that NHS organisations are required to produce. They have to ask for comments from Scrutiny and from Health Watch. Given the number of trusts that this committee firmly has, I would suggest bringing all of the quality accounts to a meeting because I think that would just be too much for one meeting. And discuss with Councillor Brown is to circulate the reports and members can provide comments if you want to that we can pass on. But the one report that has just been flagged that I've seen in my email is a report from UHB. And I'm just wondering whether that's something you might want to bring to the next meeting. But I can follow that up with the chair. It's a potential additional item for the next meeting. We're already two, so it may be a busy meeting, or it may be you want to deal with that in the same way as the others. So at every report you can have a look at, and if there are comments that come back.
The question, Chair, is whether that report ought to be dealt with on joint costs of the policies.
Has it gone to, yes. It gone to Solihull as well?
It should do. I don't know, but should that be something you ran through saying, can you consider the joint costs? Oh, the joint costs. Oh, right, so okay.
We'll do that.
Yeah.
Well, I actually wonder because UHB are the dominant acute provider for the city and for Solihull. I wonder whether a joint meeting of both scrutiny committees should be held to look at the report because it is of so profound importance to the health of both Birmingham and Solihull.
Well, we can't do the next joint hospital facility that they did with the ICU. So we have to do speak to council and try to think how we can one day short of everything.
Yeah. I think it would be difficult to hold the joint meeting of both committees when there is a joint practice for that purpose, but it's something that you can support each other about. Other members of the meeting attend meetings, but having a separate one of the committee in addition to the joint hospital, that's the actual function, I think, might be difficult.
But we speak to council, let's
you have a meeting of both committees, but a decision on the response made by any of those appointed. That's another application to.
Well, we can also bring it back to this committee after it's been considered. But as I say, UHB are the dominant acute provider and specialist provider for Birmingham and for Solihull. And it has a profound effect upon the health and well-being of every man, woman and child in the city and in Solihull. They've got a turnover of £2 million. I mean, it makes our budget into petty cash.
Council budget higher.
No, ours is committed. We've got a budget of well below £1 billion to play with.
If you put two days out and you suggested.
Yeah.
Take education out and take all the, take all the statutory stuff out. It's the controllable stuff.
And just the final point is, just at the meeting, there were a number of issues that were identified, particularly the cabinet member discussion, that the committee wanted to look at in further detail. Either, information will be circulated outside the meeting, but I think it is something I've certainly made a note down of that, because the next meeting is the last meeting, this meeting is for full year, so we can start building that to sort of pull together a list of issues that council may want to look at next year. Obviously, it'll be for next year's committee to determine that, but I think if you can start to prepare something, that might help the process.
Councillor Pritchard.
It's related to the work programme, well, not any of those specific points that Fiona's raised. It's a bit of a plea, and particularly in light of the report we had about from Red Quadrant and that piece of work, where we got a lot about the process and the brilliant work that was done, but nothing about the outcomes. And in particular, when there's a cabinet report that's coming in April, so not only do we get no kind of outcomes from that about what the actual co-production resulted in, but there's now going to be a cabinet report that's based on, which again we won't see before that cabinet meeting. Also not before the paper report, even if it did come to the next week, it's only a week before cabinet. So I suppose a plea would be, can we, probably too late this time, but if it's not, then better include this time. But can we get into a routine of getting cabinet reports in kind of draft before they go to cabinet, so we can actually input and scrutinise into them, because we don't often seem to get that. And particularly, it's a really good example actually of where it's going to cabinet and we've not even got the outcomes of this engagement work. Where it's at CLT, we didn't get any, we've not got any detail about that. A cynic could say that it's going to be cabinet report that's going to ignore those findings, so they don't want to say what those findings were. Now, obviously, we don't know that, but that's So I think if we could, get into that ability to see those draft reports, a bit like the draft budget goes to resources before it, that sort of thing, and so you can actually meaningfully input into it before it goes to cabinet.
Yeah, that's a really feed across committees, the discussions in planning for next year.
I think Councillor Pritchard, that is a point that we were aware of in terms of the sort of conflict in terms of when cabinet says when it actually comes through. I think it's something we need to build in for next year, but it is an issue that the officers are aware of. It's a complicating factor in what comes to us and the order it comes in.
I mean, it's in their interest because potentially if it's gone to scrutiny first, it might be less of the risk of it being requested and recorded. Because anything that comes up we have to find out first. So to a certain extent, it's in their interest.
I had a separate point, but just to agree with Councillor Pritchard, it would certainly make sense for the draft cabinet report in future to be presented to committee, so at least we consider it in draft form. And bearing in mind, we know it can change before it's presented to cabinet. So I think it would be useful, because certainly whilst today was useful, not actually knowing what they said as part of it is a real hindrance. And I particularly want to see the cabinet report, because I don't want it to sit there and say it was presented to scrutiny and scrutiny will find with it, because I don't know what the outcomes was. So I'm not in terms of what the outcomes may be from that, because we've not seen it. But I know that often cabinet reports will quote people are happy with something when they're not, because they were never consulted in the first place. So I think it's really, really important that we make sure that whatever's presented to cabinet is accurate, given that we haven't been shared the findings so far. My point I wanted to raise was full council is now on the 18th of April. Is this meeting still going to go ahead in the morning? Because if so, I can't attend because I have to prioritise full council.
My understanding was we were looking for it to go ahead on the 18th. Is it a problem for other members?
It makes it quite a full-on day, and likewise, I'll be normally prepping for full council at that time. It's not ideal by any stretch of the imagination.
No. So I suppose the issue would be in terms of how realistic it would be to actually move the next 18th April's possibly meeting around. We could possibly have a look at that, but it would depend in terms of a room and date being available for us to get to.
I mean, there's a reason committee meetings don't happen on the day of full council. because traditionally members aren't available to attend them because they're focused on preparing for full council, which I will have to be doing.
Getting China, it's done, isn't it?
Yeah, I appreciate it's not a decision. It's a decision that was made yesterday at CBM by the Labour Group. So.
Yeah, well, whoever made that decision, we'd already committed to meeting on Tuesday in the morning.
Yeah, so and I told the leader that yesterday, so.
Well,
Whenever we can move to see if there's another opportunity. I'm not sure how realistic it would actually be to chop it around.
But something to bear in mind if you're going to add more items to the agenda, because if I might be able to join briefly, but I suspect not.
I appreciate it would make it a very long and very, very busy day. Councillor Clovis,
Yes, committee actually, I was shocked, but it's not
Yes, it's no fault of Gail's, because, this is what happens when full council is moved, because some people couldn't arrange.
Forward if it were possible.
But if the ultimate decision is that it's got to be held on the same day, could I suggest that it is pushed back as far as the time is concerned, so that you're not starting at 10 and finishing at 7 or half 7, and moving it so that we haven't got a break at 12 until 2.
I disagree. Over a month, then we're in trouble. As in, if this committee was like it's not that, we're in trouble.
It makes us focus somewhat, doesn't it?
If we get the two knocks to see what options are available, or potentially other days, or potentially moving the following Councillor Tills's position and potentially adjusting the time of this meeting on the day.
Yeah, and it's also because the presenting the reports have got that to agenda as well, so it's also just not. So we'll have them just push back to the chair.
Just, I mean, as I assume, the 4th of April is now free in the morning, since that was the date of full council. So we can have it 2 weeks earlier, problem solved. Although that might be a little tight on turning out for report.
Full cabinet.
Well, yeah, that was full cabinet as well. So we can definitely get the opportunities report in draft.
Question of the day opportunity is this, while you think about that one. The precedent has been set where a cabinet paper is tabled, but that we have an informal briefing from a system director. I think John Williams has done this before, prior to the cabinet meeting. So although it's not an official meeting of this committee, it is at least a meeting where members of the committee get to hear the report. So if we don't have the proposal being put forward, at least we could have a briefing on the paper once it's on the CMIS system, but before the meeting itself.
I mean, that is better than nothing. I suppose the point I make there is the opportunity to influence that and be a meaningful conversation is gone because it's a finished report on the CMIS.
The options we could certainly think of, it was on the committee going forward to the next meeting. I think we need to move away from a situation where there's a bit of conflict in terms of the timing between cabinet meetings and between scrutiny meetings, so we get the information where we can actually deal with that kind of input in terms of influencing decisions.
I think the reason for bringing scrutiny in the first place was to add value to the whole process of local governance. And I just wondered, how would our views or thoughts or queries about this report be relayed to the Cabinet? Would it be for an officer to do it? Or would Mick attend as chair of this committee to relay our concerns or even praises to the Cabinet? And it would be for them to take them on board or not. Is that possible?
Something we could certainly discuss with the cabinet member, potentially, and obviously, potentially. I don't know, that's something we could need to look at.
Yes, yeah. I know there's been briefings on hospital discharge, but that hasn't been about a particular decision. Since I've been here, that there has been a briefing on a cabinet.
Going back well, I think it was John Williams who, this is the Balearian stages of the, it was the day that opportunities strategy, in other words, on this first table, then and after the cabinet papers are published before the meeting, so we're not and be privy to information. Exactly.
Yeah.
But we had the chance to listen and comment to the others. What notice was taken, I don't know, but it's better than
Yeah. But taking these comments back, I suppose,
well, there's obviously when
yes.
I think Rosendale were in charge in those days, so the precedent is there. It might be worth just checking how that precedent could be replicated.
Yeah, I suppose I'm just thinking, under normal circumstances, scrutiny of a decision would happen in public. So actually having a briefing meeting, it can allow that discussion to happen and that information can be rolled to public meeting. So it's just trying to balance the timing when the report's available. So I can take that away and get back to the chair and the deputy chair and agree available.
I think this is something okay, as Fiona's already said, the next meeting is, which is Tuesday the 18th at 10 o'clock, or possibly not. Request for calling, do we have any? Any other urgent business? Take it no urgent business. Authority to check. Really good. We probably all just wanted to say, this is Chair with us today. She's doing with the